Well, welcome to another edition of the Military Historian. Today we're going to go into a little bit of the history of what every soldier, service member is going to face. It's 65 and retirement, and what do you do with Medicare? Well, these are questions you should answer long before you get there. The reason is because it could cost you money if you don't. My next guest is going to help you get around these roadblocks before you actually face them. So you know and work with a set of knowledge that could save you a lot of money. It'd be advisable to listen to him. So stick around. We're going to get into it next on the Military Historian channel.
When you were young, a lot was asked of you, and you delivered in the jungles, in the forest of Europe, in the deserts of the Middle East. And then you brought these skills back home. You led, mentored, trained, and advised. These skills transitioned you perfectly to the civilian community. And now as you transition into retirement, who will lead, mentor, and advise you? Vetecare was written with you in mind.
Well, we're back, and this is the book Vetecare. This is exactly why we had this guest on, because this guest wrote this book. He actually worked his way around the whole system and figured out how it worked so that the rest of us don't have to. If you pay attention, he'll save you money and he'll help you out because he's dedicated his entire life to that. Colonel Cullen Wright, thank you for joining us.
Thank you for having me.
I appreciate you being here. And I brought a friend with me today that's also a mutual friend of yours. Don?
Hey, Cullen, how are you?
Chief, what are you doing? You got a celebrity there with you.
Hey, I know, man. Never would have thought it a million years. So I want to tell everybody, first of all, you hear me refer to both of them, Colonel Wright, Cullen Wright. We've known each other for a long time, and we've grown to have a very good friendship. And when I tell you guys and ladies that this man here is nothing but selfless service, you're going to see how much he cares for his veterans and he cares for the people based in this book. And I can't tell you just personally how much he's been a help to me in my life and my career. So look, this guy is nothing but the real deal. So I hope you are able to take something from this. And well, I don't even hope, I know you will be.
Well, let me go through some of his qualifications if you should wonder about those qualifications. When we spoke, Don, basically what I had talked to you about was your resume, okay?
We did.
And basically in that resume, I said that you had one of the most impressive resumes I've ever seen. Well, guess what? He's not far behind either. He's pretty close.
Exactly. You just hadn't seen his yet.
You hadn't seen his yet. So let me tell you what's on his resume. He served at the Pentagon. He was a former enlisted personnel. Did you make it to the first sergeant level, or what level did you make it to?
No, I made it to E5 when I became a cadet and got commissioned.
Well, NCOs are the backbone of the Army. Everything that goes around comes around through the NCOs. He served at the Pentagon. He directed and managed operations at the strategic and operational tactical levels. And I assume that this was in Iraq.
In Iraq and Afghanistan.
Oh, and Afghanistan as well. Wow. So he's been on both levels. And you are well-versed in investigation. You did CID. I'm sitting right next to a man who's Mr. CID. Then you got your degree of Master of Strategic Studies, and you also attended North Carolina State University. Oh, Don wants to talk to you about that.
Look, everybody knows in North Carolina, there's two schools. Well, there's one, and that's UNC Tar Heels.
Duke?
Well,
and the Tar
we're
Heels.
not talking about Duke.
Oh!
That's the wrong shade of blue. Wrong shade of blue. But because he's an NC State fan, that's a big rivalry right there. So
it is.
Yeah, friends don't let friends like Duke.
You are correct, my friend.
Once you're blue, you're deep blue, and it ain't never going to change, is it? Well, you know what? All I can say is that today we had talked about possibly going through. I'm facing that right now, literally, and we're going to talk about what I should do when I hit 65 here, as far as my Medicare and all the other supplements and the Tricare and all the other things. First of all, let's go through the different programs. There's Tricare, CHAMFA, and there's Medicare, and there's Medicare supplements, Medicare A, Medicare B, and Medicare D. Explain all of those and what the differences between each of those, and Medicare B, and explain the differences between each one of those. Break them down so each one of the audiences knows what they are before we go into them.
Sure, I'll start with the ones that we're most familiar about as veterans, starting with the VA. The VA has two gates basically that you have to make it through: eligibility and qualification. Eligibility deals with how long you're in the military, qualifications either based on income, injury, or duty location. Once you make it through those two gates, it is a healthcare system. It's not insurance, it's a healthcare system, and it's afforded to the veteran. Uh, the VA is divided in three pieces. VHA is the healthcare piece, VBA is the benefits piece. And then there's another piece called aid and attendance. But once you're into the VHA piece and then you move into the VBA, that is where you could have mortgages, disability compensation, ratings, pensions, things like that. And if a veteran makes it to a certain level of disability or, God forbid, passes from a service connected condition, then a spouse is afforded a product called CHAMP VA. It's an acronym, stands for Civilian Medical Health Program of the Department of Veterans Affairs. Civilian Health and Medical Program of the Department of Veterans Affairs. I call it CHAMP VA so much I forget the abbreviation, but that's afforded to a spouse under 65 and over 65. Under 65, it's sort of the whole system. After 65, it's a secondary payer. And then Tricare is afforded to our retirees. That typically means 20 years of service. It can also mean that someone was medically retired, not medically discharged, but medically retired. And that's the three military systems: VA, CHAMP VA, and Tricare for Life. There's also a federal employee health benefit program, which we do find we run across quite a bit. So I've kind of added that into some of the discussion that we've had in this topic. And then we move into the part that many of us don't learn about until it's time to utilize it, and sometimes learn things the hard way in that space, and that's Medicare. Medicare has four big components: A for hospitals, C, which is Medicare Advantage, C kind of for combination or choice. You put the A and B together, and then
Okay.
D for drugs. And some of those Part C plans actually include the medications also.
So let me ask you this. When you are facing that period, and I'm 64, going to be 65 years old as of September. What's going to happen is they're going to be, particularly even my civilian medical provider is going to be all over me to get up on Medicare. Now, I happen to have MPI, which is the best, but let's just assume I don't even have MPI. What would be your suggestion after retiring for 43 years from the military, and I have the option of Tricare? I do have 100% rated VA. What would be your advice?
Well, the first piece I would give you is we've got multiple systems here. I would not take Tricare advice from the VA guy. I would not take VA advice from the Tricare guy or Medicare advice from any of them. There are exceptions out there, but I do find it to be extremely rare of people who know how all five or six of these systems work together. So the first thing is you just have to be really particular of who you get your advice from. You want to have someone on the Medicare side. I recommend someone who is independent and also multi-carrier. Everyone knows kind of the big name brands, and I won't name any of them off, but they sell one thing. They sell what their company offers. Multi-carrier independent, and even better if you can find a veteran-owned multi-carrier independent. They have no vested interest in sending you towards one plan versus the other. The compensation rates for those brokers is set by the Centers for Medicaid and Medicare. So there's no financial advantage to send one anywhere than the other based on the CMS commission rates. So
Now,
that is the first thing, is just pick who you're going to get this advice from.
The one thing I do remember reading your book is that the veterans representatives, service organizations, not all of them are created equal. And you got to be very careful about who you get involved with and what they're going to do for you, because I did get my 100% through a veteran service organization. But why should you be very weary about who you're dealing with?
Well, when it comes time to either enter VHA to use the healthcare or see if you qualify for a disability compensation pension or other benefits through VBA, you do want to use a service officer. You do not want to do this by yourself. There's so many ways to get frustrated and give up. And then you also don't want to go to the extreme of hiring actual criminal actors called claim sharks that will do for you exactly what a good service officer will do, but they charge a fee for it. And we do have some organizations out there that they kind of skirt the edge of legality by not technically breaking statutes by charging members a membership fee, maybe to an organization, and then they help with the packet for free. They're kind of in the gray area, but people who say I can get you 100% and I'm only going to keep the first two checks, that's a felony. People who say I can help you with your aid and attendance packet, but I'm only going to need 25% of the first couple months. That's a crime. It's a crime to do that. The sweet spot that I like to focus our veterans and spouses that need this help also is a veteran service officer. And you can find them in a couple places. One is in those service organizations that you just mentioned. You have some great service officers in there. I would just ask you to do a little research with them, because you may have someone who was recently selected as a service officer, but may have technically gotten no training, doesn't regularly submit applications for any sorts of benefits, and may be a little unfamiliar. Heart's in the right place. They're doing a great, honorable thing, but they're just a little too new and untrained on that side. Now, you do have members within those service organizations, and sometimes you'll even have members in there that are full-time employees. This is what they do for a living, and you probably got a really good one there. The other area that I do like is our state and county service officers. They do not work for the VA. They work for the taxpayers of the community that pays those funds for them to be taxpayer funded. They're most always certified, accredited, and they work for you. And they will do everything for you. A good service officer can do everything for you an attorney can. And there are times when an attorney does need to be involved. For example, the PACT Act class action lawsuit that closed out August a year ago. That's an attorney job. When you and the VA agree to disagree, and you may decide you're going to file an appeal, a good service officer can do that, but then there will be times when an attorney can get in there for that. But that's the biggest step, is before you really get going, stop for a second and let's see who your tour guide's going to be on this journey to getting you the benefits you deserve and you've earned.
Right. Don was asking me about the PACT Act. What do you think it is, Don? I don't, because I'm not quite sure what it is either.
Well, I know it goes back to especially veterans of the Gulf War and anybody that's been over in Iraq, Afghanistan, and those. And it has a lot to do with burn pits and stuff like that. So any veteran out there should be able to put, their paperwork in. But to Cullen's point, I've heard a lot of different veterans go out there and they pay a crazy amount of money just to have somebody to send their stuff ahead, and they don't need to. And this is what Cullen is saying. And, when somebody's telling you, that was my biggest thing. If I'm a veteran, why do I need to pay $5,000 or sometimes it's based off of whatever your benefits package or whatever that comes from. Why do we need to pay that amount of money just to get something that was already there for us in the beginning? It shouldn't be that way.
It shouldn't be that way.
So look, and this is why I think I think this is what Cullen is saying is so true, and why it rings home, because look, veterans are tired, man. Look, we get it as we get older. Look, when we're young, we run and we jump and we put dirt on the wounds and we keep going. But as we get older, our bodies start to break down. And like you said, Lloyd, this is starting to happen. For me, I thought I was invincible, but now I'm learning I'm not. So these things are very important for us.
Oh, absolutely. I can entirely agree with you, because I can tell you, I've been an Ironman my entire life. I used to bodybuild. I used to do a lot of things. And I can absolutely tell you that body is not made of iron anymore. It's made more of a marshmallow. And I can honestly say to you that it doesn't work as well as it used to. and I'm going to need every bit of the VA. I'm going to need every bit of the Medicare and all of that when I'm done with Warner Brothers. I'm going to actually literally depend on Medicare and Tricare. Now, how would somebody like me get signed up for Tricare after 43 years of honorable service?
Great question. TRICARE, when you leave, it depends on the status you left from. If you left from 20 years of active duty, you have it in one way, shape, or form the moment you walk out the door, typically select or prime. For our Guard and Reserve members, once they get 20 years, they fall into a gray area where they can use a product called TRICARE Reserve Retired. Fairly expensive, but great coverage. And then when they turn 60, our Guard and Reserve members are treated just like those active duty members that walked out of the door with 20 years of active federal service. And they can use Select or Prime. One works like an HMO, which is a closed network, and one works like a PPO, which is a more of an open network. And then at 65, no matter where you came from, active guard or reserve, on your 65th birthday, not only do you have to go get a new ID card, but then you also move into a product called TRICARE for Life. It's administered by Wisconsin Physician Services. It's a third-party administrator. They do a great job with it. And there really is no registration for it, Lloyd. When you activate your Part B premium, that is your ticket to enroll in TRICARE for Life.
Now, you brought up a great point. You brought up a great point. I do have to ask this. I am turning 65 in September. Once again, I have not signed up for TRICARE because I've had motion picture. Now, I am going to need, in order for TRICARE to have TRICARE, I'm going to need Medicare Part A and B and D.
Well, you will need the A you will have because that was taken care of through payroll taxes. The B, you would actually have to opt in to that Part B premium. And that's a mistake that so many people make. And they find out the hard way because when you don't activate that Part B, not only do you not get to utilize your TRICARE anymore, but the entire family, if they're on TRICARE with you, they also lose that coverage. Your eligibility is the anchor that keeps the whole family in there. This is typically troubling when we have a veteran because they may have such a disability rating that they can qualify for Medicare under age 65. And the question of, do you want $180, $200 to come out of your Social Security benefit? If you don't explain why, logical answer to that is no. Why would I want money to come out? And when they do that, they lose that TRICARE eligibility. We've got a 37-year-old veteran right now who became Medicare eligible under age 65, didn't activate the Part B premium. He lost TRICARE, the spouse, the three kids. We're kind of working through that mess with him right now. But that veteran does have to pay the Part B premium to anchor the dependents into the program as well.
Now, would I lose that for life? Because as of right now, I don't need any part of Medicare at 65 while I'm working at Warner Brothers. But the minute I leave it, I get it. I have to have all of that. So the most important thing for me is Medicare Part B and initiate TRICARE.
Yes, TRICARE, even though you're not currently using it because you have creditable employer coverage, you are still eligible. You have that 20-year letter in your file. You're a retiree under great conditions there. So you're good. When you lose that employer coverage by choice, when you decide to leave it, you get an enrollment period there. So you don't really have to be anchored to your 65th birthday, which is when many people do, but you're still working. And you also don't have to be anchored to that enrollment period where you'll see from October to December, there's tons of commercials on television. You can't even watch a ball game for it. You're protected against both of those because you currently have creditable coverage with your employer. When you lose that, you do get to move into that world. And some people actually decide to do that while they work with that employer because sometimes the Part B premium and no premium for TRICARE is actually a better solution than an employer plan that might cost you a monthly premium and have some higher deductibles.
Wow. Now that I find that amazing. So are you saying to me that before I get 65, I should probably initiate Medicare, not so much because I have motion picture, but because I eventually want to trigger TRICARE?
You will. You can start your Part B premium at age 65. However, you do have, and we would get a broker to sit down and confirm all this with you. Sounds like from what you're telling me, you do have credible employer coverage. So that would keep you from having a late enrollment penalty, which unfortunately veterans find out about this the wrong way. If you don't sign up for your Part B premium at age 65 and you don't have creditable coverage like you do, when a veteran goes a 12-month block or subsequent 12-month blocks, there's a 10% lifetime penalty that gets assessed to that veteran. Now, currently, there's a piece of legislation. One of our team members at Advocate Health Advisors, where we work, actually started this legislation, and it takes away that Part B penalty for veterans who don't enroll because so many of us are told such bad information. It's made it through Congress. It's waiting for a vote in the Senate. But that'll be a wonderful, wonderful time because I think veterans, hands down, get more bad information than any other demographic in the Medicare space. And what makes it so um, complicated is they get it from people who have the best of intentions. They may get
Oh,
it
I know.
from someone that's talking a little out of their lane, which is where the problems occur. But I don't really believe anybody ever does anything maliciously, intentionally to a veteran. People just don't know what they don't know sometimes.
Oh, I agree with you, boy. The information that veterans get, sometimes you just shake your head and go, "Who told you that?" I'm at 100% rated, so yeah. But I have a wife, and because I have a wife, I need to make sure she's taken care of for life. She will probably outlive me. I want to make sure she has everything she needs. Don, what would you think I should do?
I wouldn't know. That's why we have
You're
Cullen.
married too.
Well, I'm a little bit further back than you are.
Oh,
So
God.
there's some things that by the time I get to them, I already know the laws would have changed some. But Cullen, you talked a lot about it, but you hit on the part about how the reserve piece changes a little bit because there's different parameters for reservists.
Okay.
And I think that's very important because sometimes when the reservists, when they're on active duty or when they get out, they kind of get lost in the system sometimes. So the question then becomes, hey, how does this really work and where do you need to do and where do you need to start planning for your part of it?
Well, if you don't have coverage, Tricare Reserve Retired is a wonderful program. Has a little bit of a steep premium to it. It's a great program, but there's so many Guard and Reserve members that don't realize when they turn 60, maybe they weren't using Tricare Reserve Retired. Maybe they were using an employer-based plan, and they're going to stay on that employer-based plan until they turn 65. Well, the premium for Tricare Reserve Retired is a little over 1,500 a month for a family. The premium for Tricare Select or Prime is in the just a few hundred for the entire year. So there's a significant savings that will happen in my household. I will turn 60 this December, and I can move from Tricare Reserve Retired to Tricare Select and just put thousands and thousands of dollars back in our family budget every year for healthcare. And then it just gets even better at 65 because the premium goes away. You have to pay the Part B premium, which everyone has to Social Security, but the premium for your healthcare goes away. Uh, Tricare for Life has no premium.
Important for some of the reservists to realize that even if you retire, and you're below the age, there is a specific age that you have to be. You kind of fall into what they call the gray area, and
Yes.
that where you can't. So, can you talk a little bit about the gray area for them to help them understand that?
Thank you. That's important.
Yes, the gray area is a reserve and guard phenomenon. You could go in at age 17 with a parent's signature. You could do your 20 years. You could actually be in the gray area from 37 to 60. So it's a fairly long time. It's enough time where you can forget that someone may have told you that you need to activate your Part B premium at age 65. But there's a long period in there. And currently, if you're eligible for TRICARE, the spouse can't use CHAMP VA. And I don't like that one because Lloyd, for example, if you were a reserve retiree, you retired at age 37 and then you went to the VA and you got your 100% rating. Well, if you weren't TRICARE eligible, then the spouse could use CHAMP VA. However, because you are, they can't. And that's one that just negatively impacts just the Guard and Reserve members of this equation. So that's one I would love to get fixed. We actually tackled the legislation for the late enrollment penalty, And that might be next. We may try and see if we can get something changed with that rule because it really does hurt our Guard and Reserve members. You have a Champ VA eligible person there that can't use it, that could have used it for maybe 20 years.
Well, that's important because I agree with you. Guys that are sitting in a gray area, and thank you, Don, for bringing that up, because that is huge. I spent several years in active duty, and then I ended my career in reserve duty. And you spend a lot of time doing on duty, a year at a time on deployments and stuff like that. And just for edification of our audience, 180 days is your minimum for requirements for the VA. You must have 180 days of continuous, active, honorable service to be eligible for any programs that the VA has.
Our active duty members need to do 2 years. Our Guard and Reserve members, 179 days, not for training. It has to be a federal order. It can't be a governor's order for hurricane relief, and it's got to be consecutive, as you said, all at one time.
Title 10 type of deal.
Yes, federal order. We've seen some state troops federalized in the last year, so that's what I'm talking about when you have a presidential order that activates National Guard members. Reserve members would always be federal.
I think you're 100% right. We are sitting in the greatest generation of soldiers who have been actively deployed than any other generation prior to that. And the reason I say that is, and yes, you're going to say World War II and World War I. I'm not even talking about the reservists and all the other ones. And because back in the day, the Air Force and the Army were combined. And then that got separated. So what we're looking at is a lot of reservists and Guard, National Guard, who spent a lot of time, and maybe out of 5 years, they would have spent 3 years on active duty. This turned out to be probably a large percentage of the military and the service members.
Oh yes, I mean we just well, we can say we left it or not, but I think the enemy gets a vote too. We've recently left the longest conflict in our nation's history, and that's absolutely no disrespect for our World War II veterans who had some of the toughest fighting ever, or Korea, and our Vietnam members as well. But we have been engaged with an enemy with an institutional memory that goes back hundreds of years, and it's a very different type of fight. And we've been in it for a couple decades now, and we're still in it as of today. We may have taken a little breather saying that, it's over, but like I said, the enemy gets a vote. They've been voting pretty hard for the last few years.
Oh, yes.
And the crazy part about it is anytime we have a conflict, whether it be here, abroad, wherever we are, the byproduct of that is going to be disabilities to our service members.
Absolutely. And I'm glad you brought it back around to that. Thank you. Thank you for reminding me where I should be. And how's that going to affect us, Colin, in the long run? And finish that thought, and Colin, and by the way, thank you for bringing it back.
But, it is a point that, I think it's important for everybody to realize, look, all of this stuff has a cost. It comes with a cost. Freedom isn't free. We've heard that 1,000 times. And this is where we have to pay for it on the back end with our service members and how they have to react to this, or how they have to basically recoup themselves once they come back. So when Cullen, when you wrote this book, first of all, I want to know what kind of drove you to make that? Why did you make the decision to say, hey, I need to write this book? First of all, that's the first question.
Well, that is a great question. Thanks for giving me a chance to give a shout out to one of my favorite people on the planet, Faye Horton. I was at a Women in Insurance Niches WIN network as a guest speaker. And at the end of it, I listened to them because they're very interesting presenters. And Faye, who's one of the co-organizers of this event, said, look, we're all trying to do the same thing for the same outcomes, for the same customers. Do something that makes you different. She said, many of you may not know, but I've written 14 books. I have a publishing company, and 4 of which have been on the bestseller list. I didn't know this about Faye. I knew her as one of our general agencies. And she said, I have a consultancy that I do for a certain price. It's gigantic percentage off if you're interested today. And I asked her, I said, hey, I'm interested in your book program. And Faye, because of my travel schedule, was very flexible with me and worked with me to get it out. And I was able to get the book out on Veterans Day last year. And really, the motivation behind it was I have just seen thousands and thousands of veterans and spouses that have been just told bad information. That there's guys that don't use the VA because they think they're taking it from somebody that might need it. And the fact is you're negatively impacting the budget. The VA is funded based on the number of enrollees at those facilities. And then I've also had veterans say, well, I'm only hurting myself, but there's a lot of benefits that can transfer and be used by family members. Aid and attendance that I mentioned is only one of those. Should I pass first? My spouse can get thousands of dollars of health care funding just sent directly for utilization. It used to be called the stay-at-home program. So when I have a veteran that doesn't use the VA and I can tell them about the negative impact they're having to the budget and the aid and attendance program, that's typically about what it takes to get a veteran involved in that. But it's no different for the other members either, the other buckets of military health care. Just a tearjerker in Atlanta one time I was giving this briefing and one of the brokers in the front row teared up a little bit. And I said, oh my gosh, I thought I might have told a joke or something and may have upset her. So I go over at the end of the briefing and say, hey, is everything okay? See, I got a friend that she's on Champ VA. I've known her for a long time. She's almost like my mom. And she finally confessed to me the other day that someone told her that if she signed up for a Medicare Advantage plan, it would kick her out of Champ VA. As a result, for a couple years, Don, to afford her prescription medication, she had been eating cat food. I, I had no
Oh,
words for that. The broker, 90 days later, supplied with the proper information, has that wonderful lady on a plan with no premium, no copay, no prescription drug cost. And at that point in time, this was a couple of years ago, a $325 food card that reloaded every month. So when I say we save and change lives, that's a life changed right there from cat food, medical bills, prescription drug costs that were crippling to none of those and some food and much honest, a better healthcare plan in place to complement that Champ VA. Because Medicare goes first and then Champ VA goes second. Doesn't have to be original Medicare. It can be these advantage plans that give you so much more, many times for less.
Cullen, you hit a point, man, that I have to say I was guilty of, and that was when I first came out of the military, and for several years I wouldn't go to the VA. I was in pretty good health, and I just wouldn't go because I was like, I was taking resources from somebody else. I don't really need the VA. I'm good. I can work it out. But, once I got into the system, I realized, man, I should have been here a long time ago. So I'm glad you brought that up because there are a lot of veterans out there who feel that same way.
It's not a small amount either, Don, that's going there. It's thousands and thousands of dollars for that veterans health care. So if you truly are somebody that's motivated by, I want to put it there for my friends who need it more than I do, which is a great veteran mindset, then get signed up for those benefits. They'll be there if you need them. And then also you have, if that's what motivates you to put something in the system for your peers, you've done that.
so I got to ask you, Colin, when we are looking at all these service members coming in to the new system coming up, and by the way, there is some issues coming up with getting certified with your percentages. What are we looking at? I think we're looking at a massive backlog coming up here very shortly.
We did have a huge backlog that got created when the PACT Act got initiated, and the VA actually put on quite a few extra employees to help with that. And that backlog has been worked. You saw during that time some of the delays, maybe for Champ VA applications, for example, they got up to almost 8 months. That's back down a lot now. I think I'm hearing a month to 2 months for a Champ VA application. But when a veteran's trying to get those percentages higher, you've got to use a service officer for that, and a good service officer. Don't feel like that you're bound to that one service officer if you don't see that they're asking the right questions. And that's one thing that I can do as a service officer. I don't get the training near the training that a full-time county service officer or a full-time service officer with a service organization gets. But I do try and give people a little bit of a roadmap. Here's the things you should expect. Here's the discussions that you need to have with your service officer. Here's the things that need to come out and the supporting documentation that service officer will put together. That's what really puts you across the line.
Okay, and the question I have to ask about that is it's crazy because, and Don, have you ever spent a lot of time at the VA?
Yeah.
Then have you ever noticed that the really good VA officers don't last very long? I have noticed that.
Yeah.
The ones who get results and get soldiers and service members the higher ratings, over 50%, which by the way, that's important. 49%, you have to give up half of your Army pay or your military pay. 51%, you get to keep both. I've never quite understood how that works. To me, that seems counterproductive.
It could be. So the less you get, I've never heard of
No,
that.
no, 49%, you have to decide which one you're going to keep, the one that's higher. You can either keep the military pay or you keep the Veterans Administration pay. One of the two, but you don't get to keep both. 51%, you get to keep both. That is really, why do you think that is? I've never been able to figure that out. It seems.
I don't know. I wouldn't have a Cullen, what you think?
Well, there's a couple. I got you on that one. There's a couple programs in the book because it's actually almost an entire podcast in itself. But they're called CRSC and CSDP. There's some different criteria in there. But for example, the one that I utilize, because I do have a rating and I do have 20 years, I can draw both. That's not the case with both systems, and there's a lot of moving components there. That's where a service officer is so helpful to make sure that if you qualify for CRSC or CSDP, that they put those in place for you and help you get those, because it does allow you to either have a better offset if you can only draw one, or you have to balance one against the other, or maybe you can be able to draw both. So you really need to make sure that you have an expert when you deal with that in particular. Yeah, if you meet the criteria to draw at 100% permanent total and you've got a retirement check that comes in, that's the best case scenario.
That's going to help you out in the back end for your cost of living
Yes.
expenses.
Yeah, because literally I'm at 100% in the VA, so I get that check. Then I get my retirement check as a sergeant first class. So it has been very helpful. I'm not going to lie to you. I mean, it's a fair trade. I gave my entire life to the military and in service of the United States government. So I don't feel guilty about that.
And you shouldn't. You should not.
It's okay to make it up on the back end. And with your disability rating and your time of service, you should be able to draw both.
Wow, thank you. You know, and I really appreciate the time you've given us, Colonel Wright. If you had to give anyone looking at 65 down the barrel, a service member, what advice would you give them?
Great question. I couldn't have teed a better one up. That's a pivotal moment because when you turn 65, you do want to use, well, even before 65, you want to use the VA. The VA will never be a complete system. They even realize that they've had to have the community care network to access almost 1 million doctors out in the community. They're part of community care network. But you do want to use the VA because for service-connected care, they are the center of excellence. They have wonderful programs for durable medical equipment, formulary, modifications to stairs, ramps, bathrooms, all those things. But at some point in time, I call it the 4 pain points of a VA user, and I talk about them in the book. You may want something closer. You may want something quicker. You may need a specialist of your own choosing, because while the VA has the community care network, sometimes referred to as the Choice Program or Mission Act, it's all the same thing. The VA is utilizing outside physicians to address the demand. Even though you have that, not every physician participates in that. It's an application process. They have to agree to take the amount the VA will pay and not balance bill a member any extra. But that's not all the doctors. And you may have something very particular and you want to see a doctor at MD Anderson or Memorial Sloan Kettering or Johns Hopkins or one of these, super centers of influence, the Cleveland Clinic. Well, an Advantage plan can give you that. Those networks are all different within those Advantage plans, and you can find one if you have the right broker that's had the right training. They can look at it. It's called a needs analysis, and they go through all the things that you like, you don't like, what you would change, what you want to sustain, and they go through all that with you. But just knowing the one to pick there and to have the person help you with that, that's key because even the Tricare folks and the Champ VA, they take that original Medicare, that A and B, and they turn it into a C. And there's a study of studies that I talk about in the certification course that I go through with our brokers that actually become Vetecare certified. And it studied 48 separate studies, and it showed that when people take that A and B Medicare, turn it into C, about five things happen. They use more preventative services, which that's wonderful. They may detect or prevent something altogether. They're spending less money. They're in the hospital, emergency room, and skilled nursing less, and they're living longer. So it's probably one of the best objection handling comments that I can say when somebody says, I'm 100%, I don't pay for anything. Why should I do this? I've got that red, white, and blue card that sits at home and gathers dust. I don't use it, your Medicare card. Well, why don't we take that and turn that into something that could maybe still gather dust, or you might decide you like using it because it may come with a gym membership. It may come with over-the-counter items. You may be able to see specialists that you want to see, maybe quicker or closer, like I said. And those plans are having a great impact on our health as veterans. You still want to utilize that subject matter expertise at the VA, but the combination that a veteran can put together with civilian and military medical, it can literally be life-saving. And that's the last one I'll close with. I told you about life changed. I was at an Airbnb with my wife, and we began to speak with the owner there and found out he was a veteran. He was a Navy guy, so I spoke slowly. I used small words. I'm just picking on Navy guys out there. But no, Navy veteran. And this guy was in shape. He looked like Willie Nelson. If Willie Nelson quit smoking weed and ran marathons, this guy was in shape. He was good. And he found out it was in Medicare. He started giving me like grief about this Part B premium. I said, hey, look, I don't set that. That's set by the government. But if paying that every month bothers you, I said, there are some plans that will do everything original Medicare does, plus they'll add things in there. And when they get to the end of it, they have a little money left over. Well, that goes back to you. Well, that intrigued him a little bit. And he said something very, very important. He said, the reason it makes me so mad is I've paid this money for 7 years and I've never had to use it. I've not even been to the doctor. I said, well, that's not healthy. You know, you need to check up every year, even if you go in there and say, hey, everything's great. You still need to go in there. So I put him in contact with one of our brokers. About 90 days later, I get a call. It says, hey, you know that plan you had me get on, I had to go to the doctor. Well, in the millisecond between the next sentence, I remember it said, well, he didn't like going to the doctor. I'm probably going to get fussed at about sending him to the doctor here. It's absolutely not what he said. What he said was, they found cancer. They found it early. The plan saved my life. And just for extra credit, I asked my doctor, what would have happened if I'd have waited till I was symptomatic? And he cut me off and said, we probably wouldn't be having this conversation, or we would be having a dramatically different one. So it's not just about saving money. This literally saves lives and changes lives. The lady that was eating cat food, her life has changed forever. So it's very important, not just what you do, but who helps you make those decisions. And I love what we do. I don't think I'll ever retire. It is such a feel good to make these changes for our veterans and their family members.
You never retire when you enjoy what you're doing, Cullen. So
No, you don't. And you know that the Lou Gehrig's disease has now been renamed to soldier's disease because more soldiers are coming back with ALS. And because of that, preventative medicine is becoming even more important. Same question to you, Don, and it's hugely important. Why?
So look, I would say that same question. What you need to do is make sure you get in the VA system. You heard Cullen talk about it. You heard us talk about it here. You got to get into it. Don't take the road of I don't need to do it. Go. It's there for you. You earned it. Go.
Yep.
The second thing that I would do is I would say get Cullen's book, Vetecare, and read it. Because look, this book is not like a book where you're going to sit down and read it
Together.
Yeah, exactly. This is not a
worth
book
reading.
that you're gonna read like it's a novel, but it is a straight step. If you look at, you see all these tabs in there for me.
Yeah.
Why? Because those are parts that
I don't know about you,
pertain to
Don.
me.
This wasn't the most exciting reading, but it was one of the most important reads.
Look, there are things in there that pertain to me, and I would tell any veteran, look, if you've been to any of the wars, there's parts in here that will help you, and there's links in there that will give you all the information that you need. And then in the worst case scenario, if you still need some more, well, I'm not even gonna say the worst case scenario, I would say in addition to, why don't you contact Cullen and his team so that they can help you through if there's questions that you need, because at the end of the day, your health is important and nobody's gonna love you more than you. So make sure that you are staying on point and staying healthy, and use the vet system because that's what it's there for.
Cullen, how can people get a hold of you and your organization? Phone numbers and websites.
For the book, it's thevetecarebook.com, Vetecare, just like veteran and care. It's actually a made-up word. Vetecare is Veterans Benefits and Medicare smashed together. We actually trademarked our made-up words. But thevetecarebook.com for the book. For those who are interested in the system as a whole, we have Vetecare.net or advocateforveterans.com, spell out the word for. And for those who wish to actually speak with someone, we have a virtual agency, and we have agents in there that have been trained and certified in the Vetecare process that can take your call, and I'll make sure we drop that number in the link here for you to call.
Thank you. Don, thank you for being here today.
Thank you.
And Colonel Wright, thank you for being here. I'm going to wrap this up today, and I'm going to let us all get on our merry way, but I hope that this information for our viewers, and I want you to all look at me very closely here. Sometimes the information we put out isn't the most exciting information that's ever going to change everybody's life. But I'll tell you what, if it saves you money and it makes your retirement a little bit better, then it's worth listening to. In this particular case, this is exactly what this information is. This is designed because you're all going to face this if you're ever a service member. You're going to face this threshold. And when you face it, you better know what the hell you're doing. Because if you don't, you're going to get bills, just like in Cullen's book, of a guy who got $1,200 in bills every month, rather than knowing what he should not have spent money on. And Cullen went in and saved him from that kind of money and that kind of economic ruin. This is the kind of individual Cullen is. Thank you, Cullen. Colonel Wright, I appreciate everything you've done, and I apologize for calling you Cullen. Colonel Wright, thank you for everything you've done.
But hey, before you go, Cullen, there's two important words that I need to make sure you hear today before we get off of here. And those two words are go Heels.
Now, I do have a son who went to Chapel Hill. I've got another one at UNC Charlotte, and I went to NC State. So we over the whole spectrum without having Dukeitis, we covered it all.
Oh, okay.
There you go.
Well, on that note, bring us on over here, and we're going to go ahead and close it. And thank you for joining the Military Historian, another episode of it. Stick around, we got more episodes coming up. Enjoy yourselves. Thank you for joining us. We know you've got places to be, but I'm honored that you showed up to listen to Don and I today, and Colonel Cullen Wright. Have a great day. Peace out. You've been listening to the Military Historian channel. If you like what you see, hit the like and share button. And email me at themilitaryhistorianpod@gmail.com. We have more episodes coming up, and you can also let me know what you would like to see. Now, all I ask in the comments section is that you be respectful, and I'll try to answer as many as I can. Thank you, and catch you on the next episode of The Military Historian.